Now this is an ultrasound study of a 60 years old male, and what we see is that the liver is normal. Now this right kidney is normal, whereas this is the left kidney, and the left kidney is enlarged, measuring 11.5. More than 11 is considered to be enlarged, and measures 6.0 centimeter in anterior-posterior diameter. More than 5 is considered to be enlarged. So this is an enlarged kidney, and this is the left kidney. This is the right kidney. So we see dilated calyces, dilation of all the calyces, and not only that, we see that the corticomedullary differentiation is intact. This is the cortex and parenchyma, in other words, and this is the pyramid. You can see this is the cortex. So corticomedullary differentiation is intact. There is no focal lesion seen relating to it, and there is no calculus seen in either lower or upper pole of this kidney. Now the kidney here shows dilation of the pelvis, significant dilation of the pelvis. This is the renal pelvis. It measures approximately 4 centimeters, and this is the proximal ureter. It is also dilated. It measures 12.6 millimeters. More than 7 is considered to be a dilated canal. So, dilated ureter. So this left ureter is dilated, and we can trace this. Now you see, let's study this ureter. You will see I can trace this ureter. This is the ureter. This structure, tubular structure. This is the ureter, dilated, and I can trace this ureter up to the urinary bladder. This is, now these are the iliac vessels, and this is the dilated proximal ureter, dilated mid ureter, measuring 18.2 millimeters in this location, and from here onwards, again you see is continuing up to the urinary bladder. This is the urinary bladder, and this rounded structure that you are seeing is the dilated distal ureter. This cystic area is the dilated distal ureter. This is the urinary bladder, and the urinary bladder, it enters, you can see it's opening into the urinary bladder. No calculus is seen throughout the course of the dilated left ureter, and there is no sign of any obstruction in its opening into the urinary bladder. This is the distal ureter entering the urinary bladder, dilated distal ureter, left ureter entering the urinary bladder. Okay, now and this is the urinary bladder. This is the prostate of this 60 years old male in transverse section, and this is the prostate in longitudinal section. This is the prostate of this area. Urinary bladder is clear of any stone, debris or focal lesion. Similarly, the prostate is of normal size, no calcification seen, no pathology seen, seminal vesicles are normal. Now one thing that one can read is the insertion of the ureter into the urinary bladder. It appears to be an ectopic insertion, because during the course of the left ureter is posterior to the urinary bladder, and here lies the urethral junction. You can see that this dilated distal ureter is entering at the in the transverse section, clearly seen it's entering the upper part of the urinary bladder here. Let me get a full transverse section. Now here you see this is the urinary bladder in transverse section, and to get the opening of the ureter into it, this is the ureter entering into the urinary bladder, but its anterior left anterior wall, this here, this is the ureter entering the urinary bladder, whereas it's normally it should have course posterior to the urinary bladder and it entered the urinary bladder at this location. So this is an ectopic insertion of the urinary bladder, of the ureter into the urinary bladder. Here you can see now I'm going to trace the urinary bladder. I'm going to trace from the urinary bladder the ureter up to the kidney. See, going up and going upwards. Here comes the pelvis of the kidney. This one is the pelvis of the kidney, and here comes the kidney itself. So this is a case of obstructive uropathy, hydroureter, left side, due to ectopic insertion of the ureter into the now you see, this is the left ureter, this is the dilated pelvis, rest all is normal, calyces are dilated, and this is the distal ureter that is entering the urinary bladder at a location which is an ectopic location. This is the urinary bladder. This is the distal ureter. And this is the kidney, left kidney, dilated calyces, dilated pelvis, and this is the proximal ureter. So this is the kidney on the left side. I'm showing you. So this is a case study of a patient aged 60 years showing dilated pelvis and the whole length of the ureter that is traceable up to the urinary bladder with no calculus, no focal mass seen throughout its course where it enters the urinary bladder. Here it enters the urinary bladder. This is the area. Thank you very much.